So the bulk of my research to date has been on access to care, but specifically costs of cancer care and how high costs can really negatively affect the access to high quality cancer care and ultimately erode the quality of the care that patients receive. This erosion of quality of care is called financial toxicity. So the idea that the costs of care can be a toxicity, just like any other toxicity related to cancer treatment, and that we really shouldn't be initiating a plan of treatment without actually talking about the side effects that we can cause. At ASCO specifically, there are 2 abstracts that our team are involved with that specifically address financial toxicity. The first study is looking just at parking fees for NCI designated cancer centers. So these are considered to be the highest standard of cancer care in the United States. So these centers are really high quality in essence. So that's the idea. So we wanted to specifically look to see what parking fees were being charged and whether or not that information was even available to patients. So for example, if they were trying to plan the cost of their cancer care, would this non-medical cost be something that they could even find? And what we found is that that there are incredible variability in the costs of parking at NCI designated cancer centers, and 40% of the centers didn't have the parking costs available at all available online, so it couldn't be planned for. And the costs ranged from $0 to $40 a day. So huge variability in that for someone who is getting treatment for a cancer could be spending over $1,000 in parking for the definitive treatment of their cancer. And that is an incredible hardship for patients and for patient family members. And it's something that I think can be addressed, and the efforts to really minimize financial toxicities on patients and families should consider parking fees, which is something that I think is many people are like, it's silly, it's just parking. But it really can build up over time, and that can really affect access to care. Our second study specifically looked at what patients reported as interventions that could actually help improve the financial hardship of their cancer treatment. And this was a survey-based study of about 90 patients who had gynecological cancers. And we just basically asked them what were the things that they felt like could help them make their care more affordable. And some of the potential solutions were very feasible and practical. And they were things like, for example, minimizing the wait time during appointments so that people had to take less time off of work, something that should be very achievable. Helping with the transportation between to and from appointments, so making that potentially more affordable, and actually knowing what things were going to cost up front so they could actually plan and make a budget so that, you know, cancer wasn't this black box that they unfortunately kept throwing money into. You know, being able to actually plan for the cost of your care can be a huge benefit for patients. And my prior research in financial toxicity has shown that when patients don't know how much they're going to be charged for their cancer care, and when it's a surprise, that can really affect their willingness to pay for care. And again, I think this ultimately goes down to what is the true north of our research paradigm, which is that we want to try to improve the quality and access to high quality cancer care for all of our patients. And addressing specifically these concerns, I think, can really help.